Hello, my name is Grace Xiong.
Hi, I'm Brooke DiVasto, and today we'll be talking about disparities in sex education curriculums and the effects on adolescent health. We will be discussing the current curriculum and what the current sexual education program looks like in the United States.
Schools are already a major provider of resources that are critical in promoting student health, such as gym classes, extracurricular sports, nutritious meals, school nurses, and health education teachers. And these resources ultimately impact behavior, mental health, academic achievement, success, and happiness in youth.
The current U.S. sex education program lacks continuity across the states, and the children are at an extreme disadvantage because not everyone is provided with information to help keep them safe when it comes to sex. The graph depicts how the 50 states in the capital implement sex education in their curriculums. As seen, 24 states and the capital require sex education in their curriculums. However, of those, only 8 require it to be medically accurate, and 4 other states require sex education to be medically accurate but do not mandate its instruction in the classroom setting. So those students might never actually be taught sex education whatsoever. In addition, there are also many students who are lacking access to sex education, putting them at an extreme disadvantage compared to those who are able to learn about it. Currently, most schools rely on the abstinence as their form of sexual education and tell students that the only method of protection they're able to engage in is by not having sexual activity, which is not helpful for students. Over the past years, there's been a constant decline in the topics taught, with most popular being abstinence, meaning that students continue to get less information or none at all about how to have a safe and sexual relationship. Rather than providing students with education on abstinence, schools need to adapt a holistic approach to sex education so students are able to engage in safe sex when they choose to. In the past, information available to students has been taught more about different forms of birth control, with females getting exposed to more than males. However, currently we're seeing a decline in the education of birth control and an increase in teaching students to say no to sex and lacking birth control education.
There are also a variety of gaps in the type of information and access to it, and many of these gaps lie in practical information, such as where to get birth control and how to use condoms. There can also be a mistiming of information where this sex education is received after the first instance of sex. Additionally, when students receive sex education from religious institutions, if sex education is offered at all, the curriculum often does not include birth control. There's a very limited time mandated on human sexuality, HIV, STIs, and pregnancy prevention. And parental sex, though stable, often has low rates, meaning it is not going to be a reliable substitute for education within schools. There's also a major problem with abstinence until marriage approach as sex education, which is the approach that was adopted by the U.S. government, in that it's not very effective in delaying sexual initiation, preventing risky sexual behaviors, or improving reproductive health outcomes. Additionally, it is problematic in withholding information about condoms and contraception, promoting religious ideologies and gender stereotypes, and also stigmatizing sexual identities that lie outside of the heteronormative norm. And still, despite all this, adolescent birth rates and contraceptive method use has improved over time, which points to the possibility that the internet has become an important new way for students to receive sex education.
We will now discuss the disparities seen in sexual education and looking at the types that currently exist in the U.S. sex program.
There are a variety of gender differences in sex education in that males and females might receive different messages from the curriculum. Females are more likely than males to be educated on abstinence until marriage, whereas males are more likely than females to be educated on condom use. Additionally, there are many racial differences in sex education, where much fewer Black and Hispanics than white males were educated on abstinence, birth control, and HIV or STI prevention, and the percentage of people who took a sex ed class in middle school and high school, or even at all, were disproportionately lower for Black and Hispanic millennials compared to white and Asian Pacific Islanders. School poverty was not directly associated with health knowledge, but instead reflected school resources, which indirectly impacted health knowledge because the schools that had lower funding also tended to lack comprehensive sex education. Schools with a predominantly non-white student population on average received $23 million less in funding than white districts, even when controlling for size. And in low-income schools, students that have lower academic performance are more likely to have lower levels of sex health literacy, and the increase in sexual health knowledge also tends to occur later for students attending high poverty schools. And it's also important to acknowledge the intersectionality of the socioeconomic factors in relation to sex health and overall health literacy. So students with high rates of poverty have a student population that is more likely to speak English as a second language, face homelessness, have unmet health needs, lack supervision, or experience crime in their neighborhood. Additionally, racial and ethnic minorities are more likely to live in high-poverty urban areas. And because of this intersectionality of experiences, it is necessary for schools to adopt a focused approach to health education and support that is tailored to the needs of their student body. LGBTQ inclusion in sex education is also a very important issue. Only a small proportion of LGBTQ youth have had health classes that include positive representation of the people similar to them or incorporated information about same-sex relationships. And additionally, queer youth are less likely to be educated on HIV or STI prevention and accessing birth control. Heteronormativity within sex education also creates a barrier for a feeling of representation or safety within this academic space. And LGBTQ youth often do not have many trusted adults that they feel comfortable confiding in and talking about sexual health, which means that they often resort to peers or the internet, which means that information they receive may not always be age appropriate or accurate. Furthermore, they face an anti-LGBTQ language within educational curriculum, which makes the space an unsafe one. And this increases the risk of discrimination and harassment of LGBTQ youth. It obstructs access to medically accurate and reliable information about sexuality and health. It dehumanizes their identities and obstructs awareness of very serious health conditions such as HPV and HIV or AIDS. And it can also increase stress and isolation for LGBTQ students. And this stress and isolation can also increase their risk of depression, substance use, sexual behaviors, and also their risk of becoming victims of sexual violence, which exacerbates current health disparities.
Another issue that we have in our current sexual education program is religious disparities. A common religious belief held is that sex is reserved until after marriage, and anyone who engages in sexual activity beforehand is committing a sin. Many schools adopt this religious practice and instruct students that taking part in this activity is going against God or some higher being that they have identified with. 19 schools have been identified to provide some form of sexual education. However, they only teach about abstinence and do not inform their students about different contraception methods that are available to them. And there are plenty of people out there who are trying to change this education. However, they are claimed to be supporters of anti-God propaganda and get quickly shut down by the government due to the freedom of religion. And by having this practice, students are only taught that the only way for them to engage in safe sex is to stay away from sex in general, which is creating an unhealthy relationship. Well, now we're going to talk about the consequences and the impacts that they have on the U.S. Currently, we are teaching students predominantly about abstinence, and doing this usually leads to more harm than good, resulting in sexually transmitted diseases, unintentional pregnancies, and sexual violence that all come with their own challenges for students to overcome due to the lack of education they receive. Studies have shown that 15 to 24-year-old students represent only 1/4 of the sexually active population. However, they account for nearly half of all the new cases of sexually transmitted infections yearly, which goes to show that the current education methods we have implemented are not providing sufficient information, and something needs to change that we can lower the number of cases we are seeing in this current population.
It's also important to note that negative social perceptions of sex can actually influence state policies, and that it may misguide state funding decisions, perpetuate parental misunderstanding, spread biased or inaccurate information in schools, and even prevent participation, even safe participation, in sex as a whole. Furthermore, there are many systemic consequences to these perceptions of sex education. So groups that are less likely to face discrimination and have a greater access to educational, financial, and social resources tend to be the first to benefit from advancements in public health and technological improvements. And this also includes access to health resources and information about sexual and reproductive health. So sex education is also very important for subgroups that are traditionally at high risk for early initiation of sex and STDs. So when you have an educational curriculum around sex education that is that's not adequately preparing or benefiting the student population, it can perpetuate harmful conceptions and norms about gender roles and the gender binary, and it also does not adequately address issues of sexual assault and intimate partner violence. And though consent is very important in sexual education curriculum, and it is being implemented in many schools, it's also important to note that this is not the only important topic that needs to be addressed. It's a A more holistic approach to sex education curriculum would be proactive in helping students build healthier methods of communication, understanding what healthy intimacy, desire, and relationships look like so that they are able to form better functioning adult relationships in their future.
Now that we've talked about what the current sex education program looks like, we will now look at potential solutions and ways that we can make a more accessible and robust education. The biggest component of improving our sex education program here in the U.S. is by adopting a comprehensive sex education program, which is a nationwide curriculum with flexibility so teachers can adapt it to teach how they like it, but they also must ensure that they include all information outlined in a curriculum. A comprehensive sex education curriculum involves 4 different components. 1, it must convey honest information that actually informs students about what sexual intercourse is and ways they can engage in safe sex, sexual activity, and have a healthy relationship. For instance, having classes about birth control, how to properly use a condom, and ways to deal with stress and anxiety that might revolve around sex, and also how to navigate teen pregnancy and options that they have available to them. The second component is having straightforward information, meaning that they're not going to sugarcoat the information revolving sex, and people are going to be provided with information that is actually going to help them and not shame them for choosing to be sexually active at any age. And this can mean using the anatomical terms when talking about reproductive body parts or explaining what an STD truly is and how to manage it. Another component is that the information must be age appropriate. In a comprehensive sex education program, students begin to learn about it much younger than what we have currently, and elementary age school children are not going to be covering the same information that, say, a high school class might be going over. However, they're going to be introduced to different topics at a much younger age to help prepare them later on. And lastly, the comprehensive sex program also has a wide range of topics, so the sex education is not just going to be able to have about how to have safe sex with a partner. It's also designed to teach people about ways to have a healthy relationship and live a healthy lifestyle. And with that, classes are going to cover more than just safe sex. It'll also have other components such as nutrition and personal hygiene, all to include a holistic approach to sex education. One example that we like to touch upon is Norway. Currently in the US, our program is adopted to say that sex is bad, and it's a non-uniform curriculum and students are taught to not take part in sex. However, in Norway, they focus their program about love, empowerment, and respect for others that teaches students to form healthier connections and make their own stances on sex. In Norway, they teach about different body parts, and by the age of 11, they're able to explain what reproduction is and learn about ways to engage in safe sex. Another big component to this is teaching students about sexual abuse, which in the US, many curriculums generally avoid this topic completely. However, in Norway, they make sure to inform students about signs of sexual assault, and if they are in that situation, they provide them with the resources that they need and what they're able to do, which is a very important part of the comprehensive sexual education program. Another important country that we like to touch upon is the Netherlands. In the Netherlands, they have a mandated curriculum that's required by law, so all students are able to have access to sexual education. And it begins when school begins, so they start generally around the age of 7 and continue this education until they're 16. In elementary schools, they learn about the family, society rules, gender norms and gender roles, puberty, and body parts. And during middle and high school, they learn about contraception, sexually transmitted diseases, homosexuality, masturbation, and abortion. And it's really important that they, in Norway, in the Netherlands, that they incorporate this into other courses rather than making it a separate course in school. So they make sure that in other classes, they're also touching upon sexual education to make it more relatable for students. They also talk about sexual desires, masturbation, homosexuality, contraceptions, and having children, how to go about abortion and the sexual diseases, again, age appropriately to students. And the purpose of this program is to reduce the harms associated with sex, namely unwanted pregnancy, sexually transmitted diseases, and AIDS. And it's been very effective. The teens in the Netherlands do not have sex at an earlier age, and when they do have it for the first time, they're noted to have a very positive first sexual experience compared to the US. Teens in the Netherlands are also some of the highest users of birth control because they've been educated on this topic. They know how to get it and what's available to them. And lastly, they're known to have 9 out of 10 students in the Netherlands use contraceptives when they're engaging in sexual intercourse, which contributes to them having some of the lowest teen pregnancy and STD rates. So we can see that if we implement this into the US, we're going to have much better outcomes.
Inclusive programs also acknowledge the intersectionality of various identities within sex education, and this would mean cultivating an understanding of one's gender identity and sexual orientation, positively representing diversity, and also actively counteracting existing stereotypes and misinformation. It also would encompass providing age-appropriate and medically accurate information to ensure that students are well prepared around this subject. And this has a variety of benefits in that it's supporting the student body and creating a more supportive environment for both students and teachers, and it also engages students more deeply within the subject so that they are able to get a better understanding of the topic. Furthermore, it's important to take an anti-racist approach to sex education and acknowledging that there are a variety of disparities in both the type and access to this information. So this might incorporate employing Black educators and health providers to ensure that students feel represented in their academic sphere, and also addressing inequalities in the distribution of school funding and resources, and analyzing sex education curriculum to prevent and counteract racial stereotypes in sex education curriculum. Unfortunately, there are a variety of resources available to help school districts navigate the system, and also to better prepare students to have more holistic discussions around the subject.
That has come to the end of our presentation. We will conclude by showing you all the sources we used to explain where all this information came from. And lastly, we'd just like to thank you for your time, and we hope that you have a better understanding and understand the need to adopt a comprehensive sexual education program in the U.S., and we hope you have a great day.